Hello again, everyone, and welcome to Doc Talk with Monument Health. My name is Mark Houston, and joining me today is Dr. Sonali Khachikian, who is a board-certified endocrinologist you've been here for 7 years?
I've been here for almost 15 years.
15, but practicing for 7? Or
practicing
did they?
For 15.
Oh my goodness. I'm going to get on Monument Health right now
But
to change that
so
on their
much for
website.
aging me.
How did you end up here in Rapid City?
So I went to school in upstate New York. I did my training up there. And then once I was done, I started having kids. And I guess work just brought me out to Rapid City.
Really?
Yeah.
I mean, that's a big jump from the East Coast out to the middle of nowhere here. Well, you must like it out here then, I'm assuming.
I do.
Awesome.
I like it out here. I like the fact that it's a small town, and I think that people kind of become your family. There's family that you're born with and family who you make your family. So.
Oh, that's good to hear. You love to hear doctors say that for sure. Well, you're an endocrinologist. Can you explain a little bit about what that means?
Yeah. So endocrinology is the study of any hormone that's put into the bloodstream. So that includes organs like the pancreas, which puts out insulin and glucagon, so type 1 diabetes, type 2 diabetes. It's the thyroid, which makes thyroid hormone. It's the pituitary that makes I think of it as the gland that regulates all the other glands in the body. It's about ovaries and estrogen, progesterone. It's about testosterone from the testicles. It's about the adrenal glands that sit above your kidneys. So any gland that secretes hormones into the bloodstream. And then I guess a lot of endocrinologists think that fat is an organ too. So that's like a big part of what we do too.
Well, we've ticked off about 10 podcasts that we're going to do with you then to cover all of this stuff for sure. Well, I think what we want to concentrate on today, doctor, is the thyroid. And this, to me, this is one of those glands I just know absolutely nothing about. It seems like you learn, just in grade schools, you learn about the pancreas and the pituitary gland and things like that. But the thyroid is one that seems to be really overlooked. What does it do? What's its function?
Okay, so the way I explain it to my patients is the thyroid is kind of the thought as the thermostat for the body. It regulates your energy level, your metabolism, how fast cells turn over, what your cycles are like, what your GI tract is like. So it regulates a lot of different things. And like most things, when you have a thermostat in your house, you like to have it between like 68 and 72.
Yes.
Or what have you. So I always tell people you don't want your thyroid over replaced because it feels like being in Arizona in the summer, and you don't want it under replaced because it feels like being in North Dakota in the winter.
Wait a minute, I'm from North Dakota, doctor.
So you know what the winter is like.
Yes,
exactly. So either extreme can make you feel not good. And I think some people think that if you're hyperthyroid or you get too much hormone, either your gland is making it or somebody's giving it to you, it should give you more energy. And I think patients are always surprised when they realize that too much can make you not feel good and too little can make you not feel good. So there's a fine range. And then the thyroid, because it regulates your energy level, your metabolism, how fast cells turn over. If you have an overactive thyroid, it can cause increased stress on your heart because it's causing your heart to go faster. It can cause increased stress on your bones because it can cause bone turnover. So there's a lot of different things it can do.
Good Lord.
Yeah.
That is, it seems like, one that just works way harder than anybody think it works for sure.
And actually, so the thyroid is super important. It's one of the screens that they do as a newborn. So it's one of the newborn screenings that they do too, because thyroid hormone is essential for life.
What can they find on screenings that go wrong in newborns?
Sometimes their babies are born whose thyroid doesn't function, or...
Okay.
Sometimes patients are born and their thyroids don't function, or sometimes it's over-functioning, depending on like if their mom had certain issues.
So are there specific? There's obviously, we'll talk about some of the issues that pop up with this, but what are some of the main issues you see with the thyroid, and what are they called?
So one of the main issues I see with the thyroid is hypothyroidism.
Okay.
And it can be for a couple of different reasons. You can have an autoimmune condition where it attacks your thyroid and makes it underactive over time. That's typically called Hashimoto's.
Okay.
You can have just an inflammation of your gland. That's called a thyroiditis. And sometimes it's tender and it can happen after a viral infection. You can have post-surgical hypothyroidism, meaning you have surgery to your gland and then you have an underactive thyroid. Other things that I see with the thyroid include nodules, thyroid nodules, which are very common. 1 in 2 people have them. And then with thyroid nodules, some of them can be benign, meaning not cancerous, and other nodules can be cancerous. Or sometimes nodules aren't cancerous, but they're super big. So it's like putting an elephant on an elevator. Like elephants are great, elevators are great, but elephants in the elevator are not great.
So what would be, if somebody is starting to feel not well, all right, and they think it might be the thyroid, what are some of the symptoms that people experience with that?
So it's a multitude of symptoms. I mean, it can vary across the board. Some patients, so normal thyroid, let's say, is like between like 0.4 and 4. Okay, let's just say that's like where the range lies. Some people don't get symptomatic until their TSH is like 20, 30.
Okay,
So
now
like,
what's TSH?
So TSH is the signal from the brain to tell the thyroid to make thyroid hormone. So
Okay.
thyroid stimulating hormone. And that comes from the pituitary. And in turn, the thyroid says, okay, and it makes thyroid hormone. So if your TSH is high, it means that your gland is very lazy because your brain is shouting at your thyroid to make thyroid hormone, right? So the higher the TSH, it means that your gland is not quite functioning properly. So when patients are hypothyroid, they can feel as though they have a brain fog. They can feel tired. Sometimes they can feel constipated. Women can report that they have really heavy menstrual cycles. Men can report that sometimes they have erectile dysfunction because of it or a low libido. Sometimes you can notice weight gain, though I think people think just because you're hypothyroid, you're going to gain a substantial amount of weight. And you do gain some weight, but it's not this like substantial amount that people think.
Right.
Because usually what it is it's swelling and inflammation. So sometimes people can feel as though like their face is puffier or their hands feel puffier. Sometimes with it, you can get an enlarged thyroid, which is called a goiter. And so sometimes patients will say they have a hard time swallowing. Those are some of the common symptoms.
Boy, these seem vague though in a sense, aren't they?
You're 100% right. So it's completely vague. So I always tell patients when they come to see me, I'm like, my job is to help you figure out what's going on with your thyroid. If there's something going on with your thyroid and we can attribute it to your thyroid, like your numbers are off and you have these symptoms, perfect. But it's possible that we do the full evaluation and you could have some of these symptoms and it may not necessarily be related to your thyroid. And I think that's where people oftentimes get stuck because they think, well, I'm tired and I have brain fog and I'm gaining weight, so it must be my thyroid.
Yeah.
And it's one of the things that your primary care doctor should check once a year anyway.
Oh, really? So if you go into your primary care, you should make sure ask about this.
Yes, they will.
They
They'll
will.
check it.
Okay. Yeah. So then what, after, if the doctor feels that this is something that it is your thyroid, and then they get sent to you. What is some of the like diagnostic testing that you do then?
So I'll
check this out.
Depending on what it is, we'll do a couple of different tests. I always repeat labs because I don't ever want there to be just one lab.
Can it be just a blood test that can
It
determine
is.
that?
It is a blood test. So it's usually a TSH. And a free T4, which is a circulating thyroid hormone levels. I like to check antibodies if someone's underactive just to know what's going on. I like to get a good family history because if autoimmune conditions, meaning conditions where your immune system attacks your own glands, is prevalent, a lot of these diseases kind of travel in packs. So I think that's important to know. It kind of gives me a better idea of what's going on. Sometimes I'll do an ultrasound depending on what I feel on their gland. And usually we go from there.
Can you feel your thyroid?
Yes. So the thyroid sits, if you kind of feel like the two muscles, the sternocleidomastoid muscles, and you put your fingers underneath. So I always tell people a normal thyroid gland feels like a fresh, thinly cut marshmallow. Like that's the texture of it. And it takes time to think about it. But like you can't just feel it, but if you hold it and then you swallow, you can feel it slip past your fingers.
Oh,
so a little bit higher.
Little
right
higher?
there. Yep.
Oh my gosh, there it is.
And it's just like very yeah.
It is.
Yeah.
It's just like a marshmallow.
Yeah.
Oh, I want to be doing that all day. I probably shouldn't be messing with that, I suppose. So once you determine maybe that they have an issue with their thyroid, then what's the next step? What are the treatment options?
Okay, so we're going down the path of an underactive thyroid.
Okay,
right?
perfect.
So if a patient checks and they have an underactive thyroid, then it's completely variable because some patients can have a TSH, a thyroid level, that's just slightly above what I told you was the normal range. Mm-hmm. And they are very grossly symptomatic. And they have a family history. And those are people who I may say, based on the art of medicine, maybe we should try a low dose of thyroid medication and see how they feel. There's other people whose thyroid levels are grossly abnormal. Like if a normal level is between 0.4 and 4, and the Endocrine Society, American Thyroid Association, says that technically you should put people on medications if their level is above 10, right? Some people will have a TSH that's like 30 and not have an issue and say they don't feel terrible. I will mention it is very normal and physiologic for your TSH to rise towards that 10 as patients get older.
Okay.
So if an older patient comes in with an elevated TSH, and that's classically where they say, I don't have any problems, I feel great, then I don't have to just rely on just that number.
I see.
So sometimes we call that subclinical, meaning you have an abnormality in your thyroid, but it's subclinical. You don't have symptoms.
Okay.
And in those patients, you don't have to do anything. There's also certain subcategories where if a female has multiple miscarriages, it could be something autoimmune. And in certain situations like that, you want to make sure that you treat a little bit more aggressively. So those are some certain situations. And then you asked me about how do you treat people.
Yeah.
So we usually treat people with thyroid medication. And there's generic and there's brand name thyroid medication. And so that's usually what we start at. It's a weight-based dose that we do. So that's traditional T4, and it's synthetic, and almost every gland in your body can convert T4, which is what we're giving you, over to T3, which is the active. Some patients will try regular thyroid medication and say, I've tried this, it really doesn't work for me. And then we have to get a little bit more creative where there is other kinds of thyroid hormone. Like it can be something called armor thyroid, which is pig thyroid. And some patients say, oh, I feel so much better on it. It's so much more natural. And I always jokingly say, like, it's not natural because you're not a pig. So it's not natural. But, I think when I first started training, you come out of training and you're very concrete about things.
Yeah.
And I was like, nope, this is the way we're going to do it. And over time, it's a small subset of my population that I deviate from what the mainstay is. But I am totally open to trying it. And what I say to people is, I don't have a problem putting you on this medication, but we still follow your thyroid levels. And if I'm giving you too much, even if you feel great, please understand, like, that I'm not being a good doctor to you. Because if I'm giving you too much and you feel great, then when you go to the ER and you have like an accelerated heart rate or you have your first fracture, then you can come back and say, you thought you were a great doctor, but you're not.
Right.
So there are certain reasons behind what we do.
Okay.
Does that make sense?
Yes, it totally does. Does it affect men or women the same, differently?
I think women have a slightly higher predisposition for getting autoimmune conditions. So yes, both men and women can get hypothyroidism, and it runs in families, but maybe women are a slightly higher propensity.
Okay. Is there anything you can do? I mean, if it's genetic, right? There's not really much you can do, but are there lifestyle things you can do to keep your thyroid healthy?
So great question. I think if you're destined to have an autoimmune condition, then you're destined to have an autoimmune condition.
Yeah.
But not everybody who has those antibodies goes on to develop an underactive thyroid. And I see a lot of patients who their doctor will check their labs and they'll have positive antibodies, and then I get a consultation. And I always tell them, like, if your antibodies are positive, it just means that we need to follow you a little bit more closely. And at some point, you may develop an underactive thyroid, but doesn't mean that you're going to. And you asked me, what was the other question you asked me?
It was just basically about the lifestyle changes. And
the other thing that you asked me is some patients ask me, like, well, can they take iodine? Because the thyroid uses iodine.
Right.
And there's actually safety mechanisms within your thyroid where if it's flooded with too much iodine, it stops functioning properly. We are not a country that has an iodine deficiency. So seeing goiters, meaning an enlarged thyroid because of iodine deficiencies, isn't that common here.
That's not a thing here, really.
It's not as much of a thing because iodine is actually pumped into the soil.
Oh,
so
sure.
unless somebody is not eating any table salt, is not eating any processed foods, is making their own bread, you don't really need it. Multivitamins have some iodine in them, especially prenatal vitamins. So I always tell them, like, don't start taking iodine tablets.
Okay.
Don't start eating kelp, which is like high in iodine. That doesn't mean you can't have sushi.
Sure.
You can, but this is like taking like large quantities of it.
So are there foods you can eat that are better, that can help your thyroid, or is that not really a thing?
I really don't think that's the thing. I think a healthy lifestyle is a healthy.
Yeah.
But having said that, there is a compound. It's called selenium. Selenium is a naturally occurring substance that you can get, and selenium has been shown to help stabilize the structure of the thyroid. So oftentimes you can take selenium and that helps.
Okay. What happens if you leave your thyroid untreated? I mean, what's like the worst case scenario?
The worst case scenario is you can end up in the ICU in a coma.
Oh boy. Okay. That's a pretty good one.
Yep. So that's a pretty good one. And so remember, the thyroid helps regulate your energy level, your metabolism. So if it's left grossly untreated and patients come in, they'll oftentimes have like very thick, leathery skin. They feel as though they have almost swelling. Their eyes sometimes may be shut. Their tongue may be very thick. They don't feel as though they're thinking clearly. You'll notice that their temperature is very low. You'll notice that their heart rate is very low. It's a emergency. It's an ICU emergency. That's why they get admitted to the ICU and need extensive care. So it can happen. So for people who need thyroid medication, I implore them,
get on it.
Even if I'm sure you can always work with your provider to find a regimen that works for you.
Yes.
And this is where the art of medicine works, which is why I can't give you a cookie cutter like, yes, if you have thyroid problems and your TSH is 1, you're going to feel great. Some people don't feel great unless their TSH is a little bit higher. Some people feel better when it's a little bit lower. And that's just something that we kind of like talk about.
Okay. Now, your thyroid, you can remove parts of it too, can't you? Is surgery an option sometimes?
So the thyroid it's like a butterfly-shaped gland.
Okay.
It has a right side, a left side, and an area over the center that's called the isthmus. There are certain situations where a thyroid needs to be removed. If you have thyroid cancer, if you have a thyroid nodule, that's really big. Sometimes because of surgery or who knows for what reason. Some people are born without a thyroid. So yes, you can remove it. And there's different papers that have been presented, and it's a little bit more than the scope of today's visit, but patients to a large degree can do well even if they just have one half of their thyroid.
Really? What happens if they don't have one? You said some people are born without them.
So if you don't have your thyroid, that's when we put you on thyroid hormone and just physiologically replace you.
So you just take it for the rest of your life then, just to
Yes.
make sure that you're getting whatever you need. Oh, that's amazing. Are there any?
And I always tell people once we figure out your dose, that's pretty much your dose.
Oh, really?
Yeah.
It doesn't-
Unless you gain a substantial amount
Sure.
of weight or lose a substantial amount of weight, or if you're a female and you get pregnant. Because women who are pregnant need a slightly like 30 to 50% increase in their dose usually.
Oh, I suppose.
But otherwise, once we know your dose, that's pretty much your dose.
Are there misconceptions about thyroid issues that you wish were not? Well, let me put it this way. Are there dumb TikTok influencers out there that you wish people would listen to? Do you have misconceptions about it that you encounter?
I think that sometimes, and I think this is where I feel like I let people down sometimes, or they leave with, I think patients or people are just trying to advocate for themselves.
Sure.
And if they don't feel good, then they know a friend who's had a thyroid problem, so they oftentimes think it's their thyroid.
Okay.
Especially if they have a family member who has a thyroid problem. And sometimes patients come in and I will tell them, like, your thyroid is actually fine, which is disappointing to them. And I said, I wish I could tell you it was your thyroid,
Right.
but you really don't want to have a problem unless you have a problem. And so oftentimes it's something else. It's either a vitamin deficiency or what have you. Or, a lot of times I'll see people and they're super tired and they don't know why and they're gaining weight. And one of the classic things I see is people have sleep apnea.
Really?
Because if you're not sleeping well at
Sure.
night, oftentimes you're gaining weight. You're super tired during the day.
Yeah.
You can't think clearly. So sometimes it's that.
Oh, that's
So, and I think that's where endocrinologists are a little bit different. I think because hormones affect all your body, I think we're very fine, detail oriented, but we can step back and say, like, well, what's going on? Like,
Yeah.
because you started this conversation saying, well, Dr. K, so many of the symptoms are so vague.
Mm-hmm.
You're right. And so the symptoms have to go along with the labs that have to go along with the patient.
right.
So.
Why did you pick this field of medicine?
So I think I picked this field of medicine because I think it's so elegant. I think that it's so finely regulated. There's nothing gross about it. I mean, the doses of medications,
Right.
like there's the doses of medications we give patients are so small and they cause such significant effects on their body.
Really?
And I think my detail-oriented mind
There we
likes
go.
like the negative feedback and stuff.
Yeah.
So
Excellent.
I can put everything into like nice, clean little like groups.
Well, yeah, that would be somebody that is very detail-oriented,
Yeah.
for sure. Dr. Sonali Khachikian, board-certified endocrinologist at Monument Health, thank you for coming in and talking. This has been a lot of fun. And I know, like you said earlier, when you were explaining to me what your job is,
right.
We have a lot more podcasts we're going to be doing with you, so just be ready.
Great.
Thanks for coming in.
All right. Thank you so much.